There are several important reasons why cardiac PET perfusion imaging has skyrocketed into the nuclear cardiology field. The diagnostic accuracy of PET imaging is substantially better than SPECT. As we all know, the image quality is also better with PET than with SPECT imaging. We're able to measure different and important parameters with PET imaging, such as myocardial blood flow on both a regional and global basis, and reversible wall motion abnormalities during stress. These reversible wall motion abnormalities translate into a higher diagnostic accuracy and better risk stratification. There are several additional features to PET imaging that are favorable. First is reimbursement, which is provided by the CMS, is higher with PET than with SPECT imaging. Secondly, the radiation exposure is lower with PET than it is with standard SPECT imaging. And finally, the protocol itself is considerably shorter, particularly using rubidium PET as the radiopharmaceutical. The current PET protocol is substantially shorter than the current SPECT protocol, particularly using rubidium PET as the radiotracer. For example, a SPECT protocol in most laboratories requires 3 to 4 hours for completion from rest to stress acquisition. In contrast, the PET protocol requires 30 to 35 minutes rather than 3 to 4 hours. This substantially improves the patient satisfaction. Patient lies down on the pallet, both rest and stress protocols are completed, and the patient is able to go home. This makes a big difference in the patient satisfaction as well as laboratory throughput. The future of cardiac PET perfusion imaging looks very promising. For example, industry is now turning to PET as an investment strategy. A new F-18 agent is being developed which will provide the ability to exercise patients with PET perfusion imaging for the first time on a routine basis. Secondly, myocardial blood flow is now becoming available for PET perfusion imaging, both with ammonia as well as, more currently, with rubidium PET, and will also be available with F-18 products coming down the line. In addition to the features that I just mentioned, camera systems are now being specifically developed for cardiac PET perfusion imaging. This, I think, is an important change from several years ago. And finally, new tracers are being developed which will provide information beyond cardiac PET perfusion, such as neuronal imaging.